It's really a very interesting time to be taking care of melanoma patients, and particularly as a physician scientist, a really very exciting time in which the research that we're doing in the laboratory is translating into improvements in outcomes in this very aggressive disease. Melanoma is a disease in which the incidence of mortality have risen markedly over the last 50 years with really no improvements in the systemic therapies that we can give for patients who have advanced disease in the last 10 to 15 years. In the last few years, we've developed a much better understanding of what are the genetic factors that drive this disease, and that's now starting to be converted into more effective treatments for patients with advanced melanoma. There is a lot of momentum in oncology right now to personalize the therapy for each cancer patient. That is, instead of using a single treatment for all patients with the same type of cancer, to figure out for each patient what is the best treatment for them. Melanoma may actually provide one of the most striking examples of this approach, with the identification that approximately half of our patients have an activating mutation in a gene called BRAF, and we now have two different drugs that, if a patient has a BRAF mutation, have a very high chance of reducing the size of their tumor and hopefully prolonging their survival. But on the other hand, in a patient without a BRAF mutation, these drugs will actually make the tumor grow faster. Now, this again is very exciting news for those 50% of patients who have the mutation that we have an effective drug for, but there's clearly a need to identify more subgroups of this disease and effective treatments for each of those groups of patients.